Hello, I am Dr. Arindam Pandey. I am a consultant cardiologist practicing in Medical Super Specialty Hospital, Kolkata. Today we will be talking on something known as bradycardia. So when your heart runs in a lower rate, that is known as bradycardia. So to understand that, you need to know what is the normal rate of your heart pumping. So the normal rate, we call it a range. It should be in between 60 to 100. So if your heart is pumping at a rate which is lesser than 60 beats per minute, we call it bradycardia. Now there are different types of bradycardia. Some of the bradycardia may be indicating you have some problem in the AV node. What is AV node? AV node is the junction between the upper and lower chamber of your heart. So if there is some problem in the AV node, we call it AV nodal disease, that will lead to the upper chamber, which is generating the heart rate, is not getting transmitted to the lower chamber because of this problem in the AV node. So commonest example is complete heart block. That may lead to bradycardia. Second very important cause of bradycardia is sixth sinus syndrome. So sixth sinus syndrome means the sinus node, which is basically considered to be the generator of your heart, which actually produces the heart rate. If there is some problem in the sinus node, that is known as sixth sinus syndrome. That also may lead to something called bradycardia. Now the question is, how will you recognize it? How will you know that you are having bradycardia? So the commonest symptom of bradycardia is dizziness, or you may feel that you cannot work properly, you are having weakness, and in extreme form you may have actually a blackout. So those are the symptoms. If you are having some of them, you might be suffering from bradycardia. How do you confirm? It's very easy to confirm. You need to just check your pulse rate. So if you're a physician or nurse, or you can go to some of the technical person who can check your heart rate by pulse examination, that will indicate that you are probably having bradycardia. And how to confirm it? You need to just do a ECG. ECG is the electrical representation of heart. We call it electrocardiogram. So that will confirm the diagnosis of bradycardia. In some extreme rare situation, you need to do a ECG for 24 hours, which is known as Holter monitoring. So that is how you confirm your diagnosis of bradycardia. And in some of the bradycardia cases, you may need a device, a medical device, which is known as pacemaker. So if you are having this kind of symptom, and if you are having confirm your diagnosis of bradycardia by pulse examination or ECG, please visit your cardiologist so that he can guide you in a proper way. Thank you very much.